I'm making this video because it seems like on some of my previous postings here on YouTube, there's been questions about how I put my temporary veneers on and then the removal of them. When I do my temporary veneers, what I do is I bond them in place, meaning in this case right here, and I'll show you this in just a moment, I've already put in the front two teeth. I did this a couple years ago. Now this patient wanted to update these. So right now on tooth number 6 and 7, he's wearing temporaries. I'm getting ready to take those off. And you'll see this is going to take roughly about 6.5 minutes total to remove these. So the time commitment isn't really that long. And to me, it works out great because the patient's temporaries stay in place. You don't have to worry about them popping off. So let me just go ahead and I'll kind of skip through this video in a few places, but I'm just using a high-speed handpiece with this 33 or 330, I'm sorry, 33 or 330 burr. It's just kind of a inverted cone type of a carbide burr. And I'm just making these vertical cuts, just kind of getting through the different layers of that composite or that integrity material, which is a bisacrylic. And I'm just kind of going again without water so I can clearly see where the temporary material stops and where the tooth begins. And as soon as I see that, of course, I don't keep going. I just go that direction. I may flip it over and I can see, you can't see it in the mirror, but I can see where the incisal extent of the temporary goes. And I'm just making those vertical cut lines, okay? And I'm, of course, doing the same thing over here on the canine. And as I keep going, let me kind of skip ahead in this video, I'm then going to move over and do horizontal cuts. The reason why I do these horizontal cuts is important because if I just did vertical, and I go in and I try to pop it, because they are bonded, there's a risk of actually splitting the tooth because there's so much surface area that's bonded. So it's kind of a stress breaker. I go ahead and put a horizontal line across there, and so you kind of get an idea. It's just this little cross shape that is that's on this temporary that I'm removing. And so as I'm kind of getting those in or going through, I then take that instrument, and you can see there's the cross mark. And I'm just going to apply pressure, not a lot. I just have to turn it a little bit and it just pops right there. If you feel like you're really having to crank it quite a bit, stop. That means you haven't gone far enough, and it's going to come off much easier if you go, of course, all the way through into where the prep is. And you can see just kind of it comes off usually in quarters like that, which is great, or sometimes they come off in halves like it did over there on that canine. And then, yeah, it's a removal process that's pretty straightforward. It's safe doing it this way, as long as you put the vertical and horizontal cuts in there. And then you can see it's still bonded in there. This is great because now the patient didn't have to worry about this thing, and I didn't have to worry about this thing popping off. And now here I am actually just, removing it. And as you'll see here, as I'm going to start trying these in, I noticed there was a little bit of resin. I went ahead and removed that. I did the same thing on the canine. Same kind of thing. I'm now kind of flicking out some of the excess stuff that kind of got in between and approximately. Side note, have your patients rinse with hydrogen peroxide or dab it on there with a Q-tip in the evening before they go to bed. It kind of helps make the gum tissue not so bleedy during this process right here. Still just kind of cleaning up, just kind of some boring stuff. I will take one of these perforated sanding strips. Sorry, my hand's blocking the view. But I'll go ahead and clean off the neighboring teeth, go in approximately just to make sure there's no residue that's in the way. So I kind of got that done, washed, dry. And then I start trying in the temporary here and putting in the lateral. And I can tell that's fitting just fine. I was able to put the mirror in there and verify that the fit is good. And then I go over to the canine, and notice that the canine isn't really quite going down 100%. And so from that point, I'll take the canine off, the veneer, and I'll take another look with the mirror right there. I'll look up kind of from the occlusal, from the incisal, and I saw a little piece of resin still stuck right there. Of course, it's tooth colored. It blends right in. And after the removal of that now allowed for the, there you go. Just kind of cleaning off that last little bit of resin that wasn't visible initially, but after trying it in, it became quite apparent where it was. Go ahead and remove that, wash, dry, try it in, try them in both together, and they look good. And actually, I'll put another video up about this guy in particular. It's kind of an interesting case. But for this video, I just wanted to show how I remove these temporaries because that seemed to be a concern among some of the people seeing my videos. And you can see that in this case, it took like 6-7 minutes, whatever, to just do those two. And it worked out great. Plus, having freshly cut enamel or dentin makes for a better bond. when you're doing these cases. So I would much prefer having something that I've already kind of prepped somewhat with a diamond burr. That's going to make that bond with the final veneer so much better. All right, and this information hopefully was good. Kind of help clear up some of that stuff about how I'm doing my cases. You want to take a look also again at the website bradrevering.com. Here I've got all the information in more detail. Some stuff here, well, most of it's not going to be clinical. It's going to be things like, for example, if you get into the site, which is free, by the way, I just picked one of them called the Marketing and Case Acceptance Course. You can just see it just has a series of videos kind of put in order for dentists to kind of help make their practices work even better. We also have live, free, at this point again, free mastermind groups that meet twice a month. So if you join this, I'd love to see you at one of our meetings. All right, take care.